As we age, the foods we choose can either heal our bodies or harm them silently over time. For seniors, especially those over 65, diet plays an even bigger role in maintaining energy, preventing disease, and supporting overall health. Nuts are often called superfoods because they are loaded with protein, healthy fats, vitamins, and minerals. But here's the catch. Not all nuts are created equal. Then some can actually cause more harm than good for seniors if eaten regularly. Today, we'll uncover the 4 worst nuts you should avoid after 65. And then we'll reveal the 4 best nuts that can help you stay sharp, protect your heart, and even strengthen your bones. Along the way, I'll share real-life stories and scientific research to help you make the smartest choices for your health. Let us begin with the nuts that could be putting your health at risk without you even realizing it. The first nut you should be cautious with is the cashew. Cashews taste delicious and are often used in creamy sauces or snacks. But for seniors, they can be surprisingly troublesome. Cashews are naturally high in oxalates, a compound that contributes to kidney stone formation, according to a study published in the Clinical Journal of the American Society of Nephrology. People with a history of kidney stones should limit high oxalate foods, and cashews fall right into that category. Take the example of Mr. Anthony, a 70-year-old retired teacher from Florida. He enjoyed snacking on a handful of cashews every evening with his tea. After several months, he started experiencing severe back and abdominal pain, only to find out he had developed kidney stones. His doctor directly linked his cashew habit to the problem. Cashews also contain a moderate amount of saturated fats, which can be risky for seniors trying to manage cholesterol. Next, let's talk about macadamia nuts. These nuts are often praised for their buttery taste, but they are extremely high in calories and fats. Just 1 ounce, about 10 to 12 macadamias, packs more than 200 calories. For older adults with slower metabolism, these calories can add up quickly and lead to weight gain, which then increases the risk of diabetes, joint pain, and heart problems. A case from a senior health clinic in California highlighted how Mrs. Elaine, a 68-year-old grandmother, unknowingly gained 15 pounds in a year simply by eating macadamias as a healthy snack. She believed she was making a smart choice, but the calorie density worked against her. Doctors recommend that seniors who want to maintain a healthy weight should avoid calorie bomb nuts like macadamias unless eaten in very small amounts. The third nut to watch out for is the peanut. Now, you might be surprised because peanuts are everywhere, from peanut butter to roasted snacks. But technically, peanuts are legumes, not true nuts, and they carry some risks for seniors. First, peanuts are among the most common foods contaminated with aflatoxins, a toxic substance produced by molds. Long-term exposure to aflatoxins has been linked to liver problems and even cancer, according to research from the World Health Organization. For seniors with weakened immunity or liver issues, this risk is not worth taking. Beyond that, peanuts are also highly allergenic and inflammatory. A senior gentleman named Harold, 72, from Texas, shared how peanuts triggered repeated bouts of stomach upset and even joint pain. When he switched to healthier nuts, his digestion and energy improved significantly. Finally, we have the Brazil nut. Brazil nuts are known for their sky-high selenium content, which can be beneficial in small amounts. But here's the danger. Just 2 to 3 Brazil nuts already give you more than the daily recommended intake of selenium. Eating them regularly can push you into selenium toxicity, leading to symptoms like hair loss, brittle nails, stomach upset, and even nerve damage. A real-world case reported in the American Journal of Clinical Nutrition showed that a woman in her late 60s developed selenium poisoning after eating Brazil nuts daily as a snack. Believing they were healthy? For seniors, moderation is key, and Brazil nuts simply aren't safe for frequent snacking. So now that we've looked at the nuts you should limit or avoid, let's shift gears and explore the 4 best nuts that seniors over 65 should eat every single day. These are the nuts that can truly support your brain, heart, and overall longevity. The first nut on the must-eat list is the walnut. Walnuts are often called the brain nut because of their high levels of omega-3 fatty acids, particularly alpha-linolenic acid. Studies from Harvard University show that omega-3s are linked to reduced risk of cognitive decline and Alzheimer's disease. A senior woman named Margaret, 74, added a small handful of walnuts to her oatmeal each morning. Within a few months, She noticed improvements in her memory and focus, and her daughter even remarked that she seemed more alert and cheerful. Walnuts also lower inflammation and support heart health, making them a top choice for aging adults. Next, let's highlight almonds. Almonds are nutrient powerhouses packed with vitamin E, magnesium, and fiber. Vitamin E is especially important for seniors because it acts as a powerful antioxidant, protecting the eyes and skin while lowering the risk of cognitive decline. In fact, a long-term study in the Journal of the American Medical Association found that seniors who consumed vitamin E-rich foods like almonds had a significantly lower risk of developing Alzheimer's disease. Take the story of Mr. James, 67, who replaced his sugary afternoon cookies with a small handful of almonds. Over the course of 6 months, his cholesterol levels dropped, his blood sugar became more stable, and he reported having more energy during his evening walks. The third nut that seniors should eat daily is the pistachio. Pistachios are one of the lowest calorie nuts, which makes them an excellent option for seniors managing weight. They are also rich in lutein and zeaxanthin, two antioxidants that support eye health and may reduce the risk of age-related macular degeneration. In one study published in Nutrition Reviews, pistachios were shown to improve cholesterol levels and promote healthy blood vessels. A case from an eye clinic in New York described how a senior patient named Rosa, 69, who snacked on pistachios regularly, showed slower progression of age-related vision issues compared to others her age. Pistachios are not only delicious but also promote both heart and eye health, making them an ideal daily nut. And finally, we have hazelnuts. Hazelnuts are often overlooked, but they are packed with folate, manganese, and heart-healthy fats. Folate is especially crucial for seniors because it supports red blood cell production and helps lower homocysteine levels, which are linked to heart disease. A study in the European Journal of Nutrition found that hazelnut consumption improved blood lipid profiles and reduced inflammation in older adults. Let's look at Mr. Robert, a 71-year-old retiree who started adding crushed hazelnuts to his morning yogurt. Within months, his blood pressure improved, and he felt more energetic and less fatigued. Hazelnuts also have a naturally sweet flavor, making them a satisfying and health-boosting snack. So, to recap, after 65, be careful with cashews, macadamias, peanuts, and Brazil nuts, as they can contribute to kidney stones, weight gain, inflammation, or even toxicity. Instead, focus on walnuts for brain health, almonds for vitamin E and cholesterol balance, pistachios for eyes and heart, and hazelnuts for circulation and energy. These simple swaps can make a world of difference for your health, keeping you sharper, stronger, and more vibrant in your golden years. Remember, the power of food lies in the choices we make every day. By choosing the right nuts and avoiding the harmful ones, you're not just eating a snack, you're protecting your body and investing in your future health.